kinesiotape, and this is, you're going to do about 3.5 squares.
Okay.
That's ideal. You can maybe skip if you want to save some, do 3, but 3.5 is pretty good. So you're just going to cut it with regular scissors. Should be fine. They get sticky. But you have to understand the properties of this tape. So basically, I'm just going to peel a little bit. You can just peel it, and that's kind of how it works. So that way, it doesn't get, when it gets stuck, you're going to have some trouble there.
Okay.
There it is. But when it gets stuck to each other. It's really a nuisance. So, you know, I like to peel it, you know, kind of set it up. So that's the way to do it. So if you want around the edges, it's going to make a difference. Like that. So you around the edges, like this. Okay, so around the edges. That way it doesn't catch any weird nooks, crannies. Alright, and then this side, if you want around the edges there, you can, but you're going to split this right, you're going to bifurcate this right about, you know, about close to like 2 1/4 square, or 2 3/4 squares. You know, roughly, basically like your thumb.
Okay.
You know, about the thumb. That's how much you want.
Yeah.
So your thumb is going to be a big marker in all this. So what you're going to do is you're going to elevate, you're going to get about 10 degrees. This is actually when your muscle, this muscle starts kicking in.
Okay.
That's the huge point. We want to try to utilize that purpose. So you're going to use a thumb length up. So it's, you know, just your thumb.
Right.
Give or take a little, it's okay. So this is how it gets funky. So I'm going to peel this for you. I'm going to have you go ahead and I'm going to hold that for you.
Okay. You know what? This is not recording.
Oh, it's not?
Oh, there's not enough storage. You know what? I'm going to have to go to picture.
Okay, yeah.
You know, there's no memory at all.
Oh, it's okay.
I'll remember.
Maybe if I can
so
get that up and then, you know.
Alright.
So here, okay, so thumb, thumb. Okay, so you go ahead, just put your thumb length.
Here?
And then, yep. You're going to see this is pretty sticky. So you're always going to start at the top first.
Okay.
So go ahead, hold that. You're going to see how sticky it is.
Yeah,
so if it touches each other, you're going to, you have to start over. Yep, so about here, yep. And you don't have to tug it. Everyone thinks tape has to be tugged, but this is like a facilitatory kind of thing. So you have this now, so it's easier, so it doesn't get all stuck. You always do the outside first, and then go ahead and just, you're gonna kind of give it a light tug, but you know, kind of push it a little bit. But and you're gonna go, yeah. Basically, you have your 2 ends of your kneecap. You want to just kind of cross that.
Okay.
Yep, and just kind of give it a light pull. Yep, not hard. Yep, there you go. Good. And then you do the inside. Outside's more important because I want it to track in.
Okay.
So just a little bit of a pull. This one doesn't really need that much of a pull, but you know, I'd say.
The same shape, right?
Yeah. So kind of let it cup this. Let this edge cup this edge. You know, so you kind of got that. And, you know, it's already gonna do some work already. Kind of if you bend it, straighten it.
Just around the
yeah, just gonna bend it straight. See how it feels. Yep. Okay. So this one is, you have a little bony prominence here. Feel that? Go ahead.
Yeah, I do feel it.
Yep. So, yep. That's where this is gonna bifurcate.
Okay.
So go ahead and you can peel that. So that's like, do the tearing of the first. Yeah. So just tear. You know, just basically you're gonna take this and you're gonna tear this leg first.
Okay.
You want to do no. You want to leave
just
the leg.
Bit,
leave the tape first. But you want to tear this part. That way you know how it feels.
Okay.
Yep. You just just
tear
do that.
Completely?
Yeah, it'll do that. And leave that on because you want to take this tab first.
Okay.
That way it doesn't. This is kind of what I found through experience.
I see what you mean.
Yeah, they get really sticky. So you take this. Yep.
Right over that bony prominence?
Yep. Okay. Exactly. Right there. Good. And this one, you want to pull, you know, 50% pull. So as you're pulling this, you know, it kind of, you want it basically to pull.
Yeah.
So you don't want to pull all at this end.
All right.
You want to just kind of, as you're going to take, you can do that. Yep.
And do I pull it as I'm...
Yep, exactly. And then just kind of, you'll get the hang of this. Yeah, and just keep patting it down. Yep.
Okay.
Yep. Good. And then this side.
Let's see. Pull this as well.
Yep.
Come around.
Yep. Good. Yep.
Okay.
Perfect. So you can check that out. Around. Okay.
Yeah, I feel the tension.
Yeah. Good. So that'll get that component. But so I want to do this back part. So all right. We want neutral. We want to prevent bending. Just kind of give you like your brain a little cue. So we're gonna do about 3 squares. I'm thinking.
Okay.
Should be good. You get 3 squares. So it's either 3.5 or 3 squares. If you go 3.5, it's not going to kill you. If you forget. Okay, and then we'll do kind of the same, but let's just hit up about 2 squares. Like this. Okay, so you got neutral here. Okay, I want to keep it there. Actually, just a little bit here. This one, this muscle. So this and this muscle are tag team. They're brothers, you know. They're not doing their job, then you know this one gets the brunt of it, or ideally this one gets the brunt of it, but it doesn't always happen. So you're gonna start like at this bottom of your nook, right? You know, this you're gonna get the hang of this, but it's gonna go here. And this you're gonna pull pretty, you know, like kind of like the other side. You're gonna moderately pull that up. And let's do that. Yep. Now straighten. Okay. Good. And so we'll do one tab where your kind of knees slightly bent, and then one tab where your knee is in you know, neutral. Okay. See how that one. This one will probably wear out quicker than the front ones, but check that out. Alright. Yeah, so it's kind of most everything I kind of do is let me see that. Let me see this. Yeah. Good. And that comes around